protocols observed. My name is Whitney Ndemo, and I am representing Group 5, where there is Magabi Eric and I, Whitney Ndemo, where we'll be talking about the mental health status of our country, Kenya. I will argue here and now that the mental health is not a risk perpetuated by those who suffer from it in order to gain attention. I don't think anyone understands how tiring it is to act okay and always be strong when in reality you are close to age. All too frequently, emotions of guilt, embarrassment, and fear hinder people with mental health issues from sharing their feelings with others. First, I'll go over the causes of mental health problems. The following are the factors that can affect someone's mental health. These are childhood abuse, trauma, social isolation, lack of confidence, accident, stress. And mental health is not a laughing matter that can be used to make fun of others. Mental health is a significant issue because when a person can no longer cope with the pain and the stress of day-to-day, suicidal thoughts can arise. It is inappropriate to tease someone's weakness because you'll never know how that behavior will affect the person. Taking advantage of someone's vulnerability can lead to depression and anxiety, which can lead to suicidal thoughts as a result of the mental health concern. Nowadays, we should take care of our mental health since if we are upset, the things that we do may not be beneficial. And mental health is significant because it influences how we think, feel, act as we navigate through life. It also influences how we deal with stress, interact with others, and make decisions. Mental health difficulties should not be considered as a deception conducted by a person to gain attention, but rather as a condition caused by society and its surrounding. Those who suffer mental health issues are most courageous. They face the misery alone, and this does not imply that they do this to please others or to be pitied. Always be aware of your surrounding and help those who require assistance, even if they don't ask for it, because sometimes they're just waiting for someone to insist to help. And those who experience mental health issues learn to distinguish who deserve an explanation, who deserve only one answer, and who deserve absolutely nothing. Always keep this in mind. Everyone pretending to be happy when they are in pain, that is just an example of how strong a person can be. In Kenya, despite the tremendous progress and success that has been achieved in diagnosis, therapy, rehabilitation of mental health related conditions in the past few years, stigma towards people living with mental health conditions and psychosocial disability, their relatives, caregivers, and healthcare professionals is still present. And stigma in particular represents a major obstacle to maintaining adequate mental health care, and this has increased reluctance to seek help, delaying a patient's diagnosis and limit their compliance to adherence to treatment. In the long term, this reduces rehabilitation effectiveness and causing a burden to families, healthcare providers, and society. Kenya, a large proportion of the population associates mental illness with evil forces, making traditional and spiritual healers the first line in seeking help. In addition, social groups endorse stereotypes and subsequently act against persons with mental illness. Cultural, religious, and supernatural beliefs contribute heavily to creating stigma, which varies according to demographics. And in addition to public stigma, people with mental illness also experience stigma from family members, and further, they also suffer from the self-stigma and experience a loss of self-esteem and self-efficacy. The situation is a sorry one in Kenya on the basis of the mental health care, because in Kenya we have only 4% of medical doctors that it requires, and with the scarcity and uneven distribution of mental health professionals, there exists a mental health provision gap in the community, and there is no health without mental health. In Kenya, financing challenges experienced by citizens in accessing services, and in this case, mental health services arise from the inability of government to fully fund the delivery of a public service. Generally, mental health services are underfunded, which undermines their delivery and renders them difficult to access. Despite the Kenya mental health policing recognizing separate funding for mental health, both at the county and the national government, they are yet to implement this approach. At both national and county government levels, there is almost negligible budgetary allocation for mental health. Surprisingly, at the national level, the amount allocated for mental health is 0.5% of the health budget. At county level, it's even difficult to ascertain how much is spent on mental health, since the county governments do not give specific allocation for mental health, but rather to health in general. However, in Kisumu, which is far ahead in such investment, mental health is allocated only 5% of the county health sector budget. Therefore, low investment at both national and county level is almost negligible in terms of budgetary allocation for mental health. And on strengthening policies, laws, and structures, all counties will need to prioritize the enactment of mental health laws and the development of relevant mental health policies. There will be need to review the content and implementation of existing law, policies, and regulation, including auditing current approaches against stigma and discrimination. There is need to advocate and facilitate the development of a clear national county structure replicable in the 47 counties dedicated to addressing mental health issues. And the proposed structures should emulate coordination structures in existing programs such as HIV and AIDS, TB, malaria, cancer, which run from national, county, sub-county, constituency, ward, and community level. The proposed structures will coordinate the following services: psychiatry services, psychosocial services including counseling, mental health support groups, rehabilitation services, monitoring and evaluation, and 5, referral pathways and ecosystem. All counties will need to prioritize the enactment of mental health laws and development of relevant mental health policies. In addition, it will be wise to form an active mental health board at the county level, so as the community becomes efficient service delivery to mental health conditions at large. Thank you.